So take out a piece of paper, a pen or pencil, and keep your lecture guide out, because I'm going to quiz you a little bit. All right, ready? Okay. I want you guys to answer. So reply either speak up, not everybody at the same time, or just raise your hand and I'll just call on you. Okay, first one. What is a short duration infection? What's it called? Is it chronic? Is it quick? Is it rapid? Is it acute? What's a short duration?
Acute.
Correct. And so what would be a chronic infection then? Correct, yes. So know the differences between the two infections. Another question is frequently missed areas of washing, hand washing, when we're doing our hand washing. Where's the most frequently missed areas? Remember?
The dominant hand, the thumb, in between the fingers and fingertips.
Correct. Correct. What is a OSHA's bloodborne pathogen standard? Remember, it's a protection for employees. Did you find it? Page 48 in your lecture guide.
You said OSHA pathogen standard?
Yes, it's the OSHA bloodborne pathogen standard. So what is it?
Oh, to protect employees against exposure to bloodborne pathogens?
Correct. Simple as that, right? So it's to protect everybody in the dental office and all employees. Okay, so do you remember the chain of infection link? Which part of the link is referred to strength of the organism?
Virulence.
Virulence, yes, that's correct. So know the differences, what the differences in the links of the chain of infection. So you want to make sure you know the portal of entry, right? You want to make sure you know what the susceptible host is, number of microorganisms, and virulence. Also, you want to make sure you know the types of transmissions. Okay. So what is an airborne transmission? What does airborne transmission mean? Yes, but more pertaining to dental, what is the terminology we use? But you have the right idea, Christian.
Aerosols?
Aerosols, okay, what are the aerosols? What produces aerosols? I'm making you guys think, sorry. Correct? Yeah, the high-speed hand pieces produces aerosols. And what else produces aerosols?
Splash and splatter.
I was actually, yes, splash and splatter is more, it's aerosols that actually fall. So splash and splatter. Splash is smaller droplets and wait, splash is bigger droplets and splatter is smaller droplets. But yes, but what type of device would cause splash and splatter? We've got the high-speed handpiece, and there's two other devices that would cause that would contribute to transmission.
The air water syringe.
Correct. And one more. You have not been exposed to this device yet, but it's called the ultrasonic scaler. When you go to dental offices, if they do a prophy and a cleaning, some hygienists use the ultrasonic scaler. And this is a handpiece that has that uses high frequency types of waves, which is water, and it sprays an intensely amount of water that produce splash and spatter and aerosols that would cause airborne transmission, because this type of device uses a lot of water. So the third thing is ultrasonic scaler. So it'd be a high-speed handpiece, air water syringe, and the ultrasonic scaler. And that will contribute to what type of transmission?
Airborne.
We just talked, yes, airborne, correct. Okay, when do we use utility gloves? What purposes?
During any type of sanitizing or disinfecting.
Correct. And one more, which you have not been exposed to just yet. So I will share that with you, is when you're removing needles from the syringe. So you'll be using utility gloves during that time as well, okay? So how do you know what types of PPE to wear? What do you think? What determines the type of PPE you're going to wear? If it's going to be a surgical, if it's going to be standard PPE, which are mask, goggles, gown, gloves, or is it going to be mask, goggles, gown, utility gloves? So what determines what type of PPE to be worn? What do you think?
Maybe
The type of procedure you're going to do.
You're on the right path, Noelle, but what I'm more looking for is the type of exposure that you are that you are in the midst of. So what I'm saying is, when will you use utility gloves? When you are,
Disinfecting, sanitizing, and removing needles.
correct, and when you're sterilizing. Okay, sterilizing instruments. So to answer the question, when, not when, what determines the type of PPE we use is depending on what we're doing, what type of exposure we are in the midst of. So are we going to wear utility gloves when we're treating a patient?
No.
No,
No.
right? So just think what type of exposure you are in the middle of is going to determine what type of PPE you're wearing, okay? That's a tricky one. It's one of those tricky questions that are out there. What is a universal precaution?
Related to all human blood and body fluids are treated as known as to be infected with bloodborne diseases.
Okay. And so, yes, that's correct. But what is it considered? Are bloodborne diseases, is that something that can be contagious in any way? Is that contagious in any way? Do you think?
Yes.
Is the answer yes? Yes. So what universal precautions means, we would just want to know that we want to treat these patients as they are, we are thinking that everybody that walks in the door is contagious. So it's our job to prevent any cross-contamination, prevent these types of microorganisms, if they are contagious, to make sure that we don't spread it to everybody else in the office, okay? Does that make sense?
Yes.
All right, let's see what else. How often should the exposure control plan be looked at?
Annually.
Correct. What is the most severe, so when we're talking latex allergies, what's the most severe one? Last one is called what? There's a name for it.
Anaphylaxis.
That's the answer, yes, anaphylactic. What's the bloodborne pathogen standard do? Who does it protect, should I say?
Can you repeat the question?
What does, who, well, okay, let me start over. Bloodborne pathogens protect who? The bloodborne pathogen standard protects who?
It protects the employees against exposure.
Correct.
blood-
Correct. So it protects the employees. So what happens if you get if you are in an exposure incident? What do you need to do?
Find the cause of what might have caused the incident, like what you were exposed to. And then, well, sorry, excuse me, remove your gloves. Sorry, I'm trying to find it again. But basically, you're supposed to remove your gloves and then try to find what was the reasoning for it, and then disinfect everything and sanitize everything.
Okay. You're on the right page. You're on the right page, but what's the first thing you need to do, you said, Ms. Eden?
Stop the procedure.
Okay, and after that, what do you do?
You would kind of see like, or try to find like the equipment that you might have like accidentally hurt yourself with.
Okay, so just remember, you're trying to take care of yourself, right?
Mhm.
So you're gonna step away from the procedure, and then you wanna make sure you remove your gloves, right? You're gonna wash your hands, and then with soap and water, right? You wanna make sure you get everything clean. And then one thing that you need to do also after you're washing your hands, you wanna make sure you squeeze that wound. Squeeze the blood from that wound, okay? And just to clean inside of that wound out. So as you're washing your hands, you're squeezing the wound at the same time, right? And then after that, of course, you're gonna put a little antibiotic treatment on there, put a Band-Aid on there, and then at the end is when you're going to figure out what happened, okay? What caused it? You're going to make sure you report it to the doctor and let him know that, doctor, I was just I was in a exposure accident, and then he'll ask you all these questions, and then you go ahead and do the post-exposure management and follow through that way. Okay. So to answer the question is, what's the first thing you do?
Step away from the procedure.
Correct. Then
Wash.
Remove gloves.
Oh. Remove gloves.
you want to remove your gloves. Then you want to squeeze the blood from the wound, okay? And then you're gonna, before you're what? So you want to squeeze the blood before you're washing your hands. So there'll be a little blood on the surface, and then you're gonna wash your hands with soap and water. Okay? Now, can you use alcohol rub if your hands are contaminated?
No.
Correct. No. When can you use alcohol-based sanitizer?
After washing your hands.
Nope. Why would you use alcohol-based sanitizer after you wash your hands? You're washing your hands twice, right? So at what point can you use alcohol-based sanitizer? Correct. So if there's no blood or saliva or perspiration on your hands, you're good to use alcohol rub. Oh, you know this one. I have a nice question. So, a dentist will provide the hepatitis B vaccination, right? Under what category of an employee? Do you remember? Category 1, 2, or 3? What was
Category
category 1? I'm sorry, what did you say, Ariana?
I was just saying it was categories 1 and 2, but I gotta find
That's
what
correct.
those are.
No, that's correct. That's correct, because 1 is you are in contact, right, with blood and saliva, because that's part of your job as chair side. And the category 2 is what? You may on occasion. So the answer is category 1 and category 2. Okay, those are the type of employees that would need to have the hepatitis B vaccination. So what does the CDC do?
They make recommendations based on the research that they do or research that's available.
Yes, so based on research, based on scientific evidence. So that's correct, Noel. So yes, so they're not a government, they are a government agency, but their recommendations are based on scientific evidence, right? Let's see. One more. Describe, what is a sharps container? What is it? What does a sharps container look like?
Hard plastic, usually red. It usually has like the waste sign on it. It's to kind of keep all of your needles in. It also has like a hard plastic top on it.
Battery low.
Okay, you're on the right path. So just know that it's covered, right? If there's no open tops, it's covered. And it's leak proof and it's very hard plastic, so it's puncture resistant as well. Okay. All right, let's see. When do you use sterile gloves? What are sterile gloves used for? Those are the gloves that they're not ambidextrous. We have a right hand and a left hand and right hand. When are sterile gloves used?
Used in invasive procedures.
Correct. Invasive surgical procedures. So just remember it's for surgery. All right. I think you guys should do well on the quiz. So the quiz is 28 questions, 27 questions, multiple choice or multiple guess, however you want to look at it. And the quiz is September 30th. So not next week, but the following Friday. So what's going to be happening next Friday is we're not going to really have a lecture per se. So our lecture class is going to be lab. So we're going to pretty much have lab from 8:30. So I'm going to have my early lab 8:30 to 10:05, and then lecture from 10:30 to 12:20. So the lecture component is going to be lab as well. So there's going to be essentially like 3 labs. And we're trying to make up for this week that we missed because we're not doing lab today. So next week is going to be all lab. There's not going to be any lecture. That's why I wanted to power through chapter 19. And so that you'll be ready for the quiz in 2 weeks. Also, let me see if I could. Let me show you here. I want to show you my Canvas shell. So you'll notice in the module, for chapter 19, there are some self-paced homework assignments, okay? So the PowerPoint is available today. And what I want you to do with the PowerPoint, which you should have it all completed after today, after lecture, is to go ahead and submit your lecture guide, pages 42 to 58. So I'd like you to scan it and then submit it to me as either a Word doc or PDF. And then you get 5 points for that. So that's the extra assignment there. That's due next week. It's due on the 23rd. And then you have your discussion board, chapter 19. Okay, so make sure you identify the links in the chain of infection. Don't just tell me what they are, tell me what they do as well. And then explain the importance of hand care for dental assistants. Okay, so make sure you answer both questions. And then if you're the first one, you'll need to check back and see if a classmate has responded, and then be respectful, and then go ahead and respond to your classmate. So there's 2 steps in the discussion to get the total 5 points, right? To answer the questions and then respond to a classmate. So you've got your discussion board, and then you have the chapter 19 study questions. So make sure you download the document. So you'll click download, right? Now the study questions, there's a lot of questions. So you would download it and then put it on your desktop and go ahead and answer the questions. And then you're going to submit that as either a PDF or a Word doc to me as well, okay? And the study questions are due on the 30th, but again, if you submit them to me early, I will grade them early for you. I don't have mine set up automatic like other instructors do just yet. I'm in the process, but in the meantime, I'm here to help you. If you, like, again, if you submit it early, I'll grade it, so you have more information to study off of. Okay, and again, your quiz is on September 30th. So this is what you'll see. You see my shell, but I'll show you what you'll see. Okay, so the PowerPoint is for you to fill in your lecture guide notes if you didn't fill in everything. You've got your discussion board. So the lecture guide notes and the discussion are due on September 23rd, and then you have your study questions, which are due on September 30th, and then the quiz on September 30th. So what do I need to study for the quiz? You guys know that answer? What do you need to study for the quiz? You need to read the chapter, right? You need to read the chapter 19, because there's a lot of information in that chapter, and all that information, I don't have enough time in class to go over all the information in the book. So make sure you read chapter 19, make sure you review your study questions, make sure you review your lecture guide, and you should be good. Any questions?
So is our
So
original,
next week, yes, go ahead.
our,
I'm
orig-
sorry.
our original discussion post, like our response to your prompt, is due today?
The 23rd, no.
Oh,
No, I wanted you to use your lab time today to do your homework assignments. Just so that you have some some leeway, because I know you have other classes, but I wanted to give you your lab time today to go ahead and do your discussion question and maybe upload your lecture guide notes too. Does that make sense?
Yes, thank you.
Okay, you're welcome. So again, next week is pretty much going to be all lab. So what are we doing next week in lab? So be prepared. Hopefully we will be back on campus on Monday. So you will have your time, your Monday time to go ahead and practice if you need to practice. We're going to do clean and disinfect the treatment room. So you're going to be evaluated. So we're going to do checkoffs on cleaning and disinfecting the treatment room. So it's going to be a couple weeks that you hadn't, well, it'll be a week. Yeah, it'll be 2 weeks. So make sure you brush up on cleaning and disinfecting the treatment room, read your procedure sheet, read your eval form, and don't forget the tray, right? The tray with the cover. So that's the first thing we need to remember to do is to take that tray, cover our instruments to the sterilization area, right? So don't forget that. So be ready with full PPEs. We're going to do the checkoffs on cleaning, disinfecting the treatment room. And then we are going to move forward. We're going to learn how to use the ultrasonic machine. And I'm going to go ahead and do the demo on sterilization, the entire process of sterilization. And pretty much I'm going to be doing that demonstration during your lecture time around 10:30. Okay, because that's a critical procedure. And there's a lot of critical points in sterilizing instruments. All right, any questions? So what's happening next week? Somebody? Anybody?
We're getting
Pretty much. So there's not going to be a lecture. Pretty much. So if you are in the morning lab, we're going to be doing checkoffs for cleaning, disinfecting the treatment room. Then it'll be the lecture time, right? Everybody's going to be together and we're going to meet in the clinical area. And at that time, I'm going to be doing the demonstration on the ultrasonic and sterilization. You will have an opportunity to practice at that time. And then if you're in the second lab, we're going to be doing checkoffs again for cleaning, disinfecting the treatment room. Does that make sense?
Yeah.
So essentially no lecture next week. That's why I wanted to power through today, just so that we get caught up. So again, hopefully Monday we are back on campus and you'll be able to use that time on Monday for your, to review your skills with Mrs. Kusick, right? Skills lab. That way you will be all fresh and ready for Friday and you'll ace your checkoff. All right. Any questions for me? Let me just read my notes real quick to make sure I went over everything I wanted to go over with you.
Miss Minster.
Yes.
So it says today we have an autobiography due, but we don't know. Never mind. That's for a different class.
Not with my class. Is it with Mrs. Kusick or is it with Mrs. DeLeon?
Yeah, it's for Kusick. I'm sorry.
Okay. All right. You're just trying to throw me for a loop. That's fine. Okay. I'm just reviewing my notes real quick. So again, what is due next week? Discussion questions, your lecture guide notes. And then what is due? Your study questions are due the following week, which is September 30th. So you have 2 weeks for that. Again, if you get them into me early, I will grade it early. So you have something else to study off of. When is your quiz? September 30th, 2 weeks from now. Next week, pretty much is going to be all lab. And again, next week, make sure you're ready in full PPE, have your evaluation forms out, ready to go. And, oh, I know, one more thing I need to add. I just wanted to clarify, when you are cleaning and disinfecting the treatment rooms, you know how we have the barriers on the tray handles, right? To cover that button. Now, the reason why we have the barriers over the button is because that area is very hard to clean. So you'll notice that when the barrier's on the handle, it doesn't cover the entire handle, right? So what happens? It leaves part of that handle open and it could become contaminated. So what we want to do is make sure once we remove that barrier, we wipe that handle as well. Okay? Because again, that barrier is not long enough to cover the handle entirely. So we want to make sure we go back and clean and disinfect the handle as well. Okay, got it?
Yeah.
Are we good? Okay, all right. Well, I'm going to go ahead and end class. Unless you guys have questions for me. You guys are all set. So make sure that you do those assignments. And you should be good to go, and I'll see you next week. Okay? All right, have a great weekend.
Bye. Thank you.
Bye.
Bye.